Good evening and welcome to VA's Women's Health Town Hall, June 2025. We will be with you for the next hour to offer education specific to our women veterans and provide information on our services that are offered in our VA Northeast Ohio station. And we'll take some questions at the very end. I'd like to introduce our Chief of Staff, Dr. David Mazzaro.
Thank you. Good evening. Thank you for joining our Women Veterans Town Hall. I'm Dr. David Massaro, the Chief of Staff at the VA Northeast Ohio Healthcare System. It is my honor and privilege to welcome you. At VA Northeast Ohio, we are proud to serve veterans and excited about the opportunity to highlight programs and services offered in our facilities. Tonight, our event will focus specifically on the unique and individual health needs of our female veterans. We're also here to create a supportive space to discuss critical topics in women's health, share resources tailored to your experiences, and ensure your voices are heard. We strongly encourage you to take full advantage of asking our specialized women's healthcare team about what's available to you at VA Northeast Ohio. Women veterans represent the fastest growing group within our veteran community, with over 2 million nationwide. VA Northeast Ohio proudly served more than 11,000 female veterans in fiscal year 2024, and we are committed to continuing to deliver world-class, gender-sensitive care tailored specifically for you. Our dedicated women's healthcare team provides comprehensive services, including primary care, gynecological services, maternity care, cancer screenings, and mental health support. On this call, you will hear from an experienced panel of women's health providers and professionals who are eager to take your questions and plan to use your feedback to enhance your future VA experiences. Thank you again for attending tonight's town hall and for your service and your trust. We look forward to your questions and to ongoing dialogue about how VA Northeast Ohio can continue delivering the world-class care every woman deserves. I emphasize the request that this is such a significant opportunity for all of us. And again, thank you for the opportunity to serve you.
Thank you, Dr. Mazzaro. We appreciate your feedback and your support of our program. Let's start with our Women Veterans Call Center line. There's two ways to call us. You can call us through 1-855-VA-WOMAN or through www.womenshealthva.gov. If you feel you can't find an answer or need help with a department, please feel free to call that Veterans Call Center. Obviously, if it's a medical emergency, you would obviously call 911. So first, we'd like to start off and introduce our dedicated women panelists for the day. My name is Ellen Rogers, and I'm the Women Veterans Program Manager. We have Dr. Lori Leonard. She's our Women's Health Medical Director and the Chief of Women's Health. We have Dr. Susan Worley, our Chief of Gynecology. Reverend Dr. Nancy Lucian is our Women's Health Chaplain, and Dr. Marcia Aranovich is our Women's Health Physical Therapist. Joining us also is our social worker, Isabel Erb, and online is Jennifer Schmidt, our Transition and Care Case Manager. As you can see, we have 12 outpatient clinics located in Northeast Ohio. All of our clinics offer primary care and women's health specific care. In addition, we have the VA Medical Center here at Lou Stokes downtown, and we also have a VA annex. This is a picture of from East 105th Street to look at our annex. The annex is located right off East 105th on the corner of that and Magnolia Street. It is a Model 3 clinic, which means we have a private office and we have a private entrance for our women veterans. We have quiet, secure, dignified private rooms that include a bathroom with the exam rooms. We have state-of-the-art gynecology and procedures. We also offer group therapy and education space. In addition, pelvic floor physical therapy is located within the Women's Health Clinic. And outside of our clinic, within the facility, we have a Mamava pod on site for lactating and breastfeeding mothers. Here's a picture of inside our facility. This is the waiting room for our women's health clinic. Here's an additional picture. And in this picture, you can see the elevator, which is located right next to our staircase. There's only a couple stairs, but it's important for accessibility for our veterans that can't use the stairs. Dr. Leonard, I'll turn this slide over to you for ancillary care.
Yeah, great. And thank you all for joining us on the call. Just wanted to highlight again some of our ancillary care that we provide in women's health. We talked about maternity care, childbirth education, and lactation support. Our maternity care coordinator will contact our pregnant patients through 1 year postpartum for support and extra care. You're going to hear from chaplain services later in the program. We have social services here tonight for any questions that you have. We're seeing lots of growth in our breast program. Our high-risk breast clinic helps to identify women at risk for breast cancer and gets them to biopsy if needed, genetic testing if needed. You're going to hear from Dr. Aronovich later as well about our pelvic floor physical therapy program. Dr. Worley is here, who is our gynecologist, chief of gynecology, and specializes also in urogynecology. We can also do fertility, beginning evaluations. We have a women's health specific PharmD who can do preconception evaluations, hormone therapy evaluations, as well as diabetes, hypertension management. We work with whole health within our department, as well as mental health. So just about anything you need, we have. If we don't have it, we're going to find it for you. So I just wanted to bring up, you know how every month has something. June is Migraine Awareness Month. And on this slide, it just talks about some of the triggers and symptoms. The reason I am so passionate, I guess, about bringing this up to you is little known fact that migraines with aura, which means symptoms before the migraine starts, the headache part, which is usually flashing lights, that kind of migraine does increase risk for cardiovascular events. It's also something that impacts our decision for what type of contraception you're using. So please don't ignore your migraines. Please tell your primary care provider about them. It's not just a headache. So wanted to bring that to your attention. This just talks about different things that we can do. If you're somebody who hates medication, there are lots of ways we can help you manage your migraines. So please contact us if you've got migraines for this Migraine Awareness Month in June. All right, so I would like to turn this next part over to Dr. Reverend Nancy Lucian regarding our chaplain services.
Thanks, Dr. Leonard. You're welcome. So chaplain services has been embedded in women's health since we obtained the new building. I focus primarily on women's health. There are individual sessions for spirituality or religious struggles, as well as group sessions. Currently, all are being offered virtually, and that's been a beautiful switch for us because we don't have to worry about space or number of participants. We have them for moral injury, both a 4-week moral injury group to educate you on what moral injury is, as well as a 12-week group, which more intensively works through it. Then we have spirituality through all the creative arts, which includes art itself, as well as writing. We have an emotional exploration group, and currently this year, a brand new group on a book club. It's called Gold Mining the Shadows, which looks at the avoided parts of our lives that we don't befriend and need to reincorporate into ourselves. We have a contemplative practices group, which looks at contemplative practices across all faith traditions and cultures, a mind-body skills group, and I also offer a women's only Reiki, and a tapping group, which is co-ed, both virtual and adjunct modalities to what you might currently be doing. If you're interested in any of these, please don't hesitate to reach out or talk to your provider, and they'll tag me in your note and we can get you started. Thanks. I'd like to turn this over now to Dr. Marsha Aronovich.
Hi. Before I start telling everyone all about pelvic floor physical therapy, hopefully you all will feel as passionate as I do about it by the end, I would just like to remind you that if you do have any questions at all, feel free to submit it either through the chat or through the question and answer, and then we'll be able to help answer some of those questions. All right, so again, my name is Marsha Aronovich, and I'm one of the 2 pelvic floor physical therapists for the Cleveland VA. So the pelvic floor, it's one of those kind of mysterious things. We hear buzzwords about it. Basically, everyone has a pelvic floor. Men have pelvic floor, women definitely have pelvic floors, and we often don't connect with it. Partially because we're never taught about it, not something we're taught about in health class in high school. Partially, it's not something that's passed down from generations of knowledge since it's more of a taboo subject. So many of us don't even know that these muscles exist. And if you don't know muscles exist there, then it's hard sometimes to find treatments or to explain some of your symptoms when really it can just be coming down to the muscles and the nerves. So what exactly is the pelvic floor? Basically, it's a group of muscles. It's a bowl shape, and it attaches from the front of your pubic bone to your tailbone. So you can kind of think of it like a hammock. And it has multiple jobs that it does. So most of the time we think of, oh, I'm peeing in my pants. I hope my pelvic floor muscles kick in. So one thing it does is it supports the bladder and your bowel and your reproductive organs. But it also acts as a sphincter. So that means it's closing down to make sure we're not leaking all the time, or the reverse, that the sphincter will relax so that we can empty when it's the appropriate time. It's in charge of sexual function and fertility. It works with our abdominal and back muscles to provide core stability. So a lot of times if we're having back pain and we've tried so many things in the past and our back pain really isn't changing much, it may be a pelvic floor dysfunction. And then another really big piece to it is it's our respiratory support. And we're going to talk about this more later, how it works with your diaphragm and how breathing is so important to get the pelvic floor functioning right to reduce symptoms. So common pelvic floor issues, urinary incontinence. So that's where the bladder is pulling you to the bathroom, or you place the key in the door and all of a sudden you have to go. Pelvic organ prolapse, pelvic pain. So any pain in the underwear region. So it could be tailbone pain, groin pain, pain in the vagina, pain in the bladder region. Painful intercourse or pain with medical exams. Constipation or bowel dysfunction. And then a lot of times people don't realize, but stomach pain usually has some type of pelvic floor component, and we can help manage some of the symptoms that you might be having in the abdominal region. So what exactly is pelvic floor physical therapy? Basically, it's your normal physical therapy. So we're still focusing on your muscles, nerves, and all the connective tissue and how it relates to the pelvic region. A lot of times we do more than just Kegels. Most of the time people actually need the opposite. We need reverse Kegels. So we're going to address the strength, but we're also going to address relaxation. And more importantly, how those muscles are coordinating together. And we do this by combining a whole bunch of education, usually more than people even want, manual therapy, exercise, and different behavioral training. So a lot of times patients will come in for the first visit and they either have no idea why they're coming to physical therapy, or they've heard of it, but they really don't know what to expect. So over the first few visits, different things you can expect is first visit, absolutely, we're going to go over a detailed history. So we're going to ask about your medical history, lifestyle history. We'll ask about bowel issues, bladder issues, pelvic pain, sleep, stress, your diet, all because this plays such an important part in how the pelvic floor is functioning. And then based off your answers, we'll have lots of options for an objective assessment, but usually we're going to look at your posture. We're going to look at your breathing, see how your body's moving. How do you transfer load? The pelvic floor specific part of the exam, lots of different options for it. Usually we start with level 1, which is just building some type of connection and awareness and kind of reintroducing yourself to your pelvic floor muscles. Then we do an external exam, and again, all these are just options. There's no stirrups, no speculum, so it's not quite the same medical exam that people would expect. And we're looking to see what happens when you contract your muscles. Can you relax your muscles? What happens when you cough? How does that pelvic floor respond? And then if you're more curious and we still think that this would be a good part for your plan of care, we might consider doing an internal assessment. My job is to look at how the muscles are feeling, is there any tone to them, is there any tissue restrictions? And we'll check all 3 levels. And then again, we may check to see how well do you contract the muscles, relax the muscles, and coordinate. This can be very useful because a lot of times we can't see these muscles. So it sometimes helps to have this feedback to get a better visualization of where the muscles are and what they're doing. And then based off all this, and most importantly, based off of what your concerns are, we're going to come up with goals, go over the anatomy, and basically try to improve some of your quality of life. So this is a whole bunch of treatment techniques that we may use. And the nice thing is because we have so many options, it means we can really start with wherever you feel comfortable. Most of the time, I do warn people the first visit may feel a little hippy-dippy because we're going to do some breathing and relaxation 90% of the time. But this helps build a strong foundation for a strong pelvic floor. So, because I love posture and breathing so much, and yes, as we all need to sit taller, including myself. So I never judge anyone's posture, because as you can see, I'm in the same boat. But basically, when we have poor posture, it can also create shallow breathing. And so if you can look over at the picture, we see the stomach muscles in the spine, and then at the bottom, there's like a oval, that's your pelvic floor, and at the top, we have the same oval that looks like a hill, and that's your diaphragm. So when our diaphragm takes a breath in and lowers down, our pelvic floor should also passively lower down. When we go to push out air, our diaphragm raises up, our pelvic floor should contract and raise up. So if we have various breathing patterns, which can come from posture, can come from daily activities, can come from stress, a lot of times our pelvic floor is not getting that movement that it needs to function to the best of its ability. So here's the fun test. Feel free to try it if you want. If not, you can think about it. Maybe you'll try it later. But a quick screen just to see what's going on with your pelvic floor. So let's start with the breathing first. You're going to place one hand on your chest and one hand on your stomach. And I want you to take a breath in. This is a no judgment breath. Yep. And you're going to breathe out. And then you're going to do it again. What hand do you feel moved? Do you feel the hand on your chest move? Do you feel the hand on your stomach move? Do you feel them both moving? Maybe you feel nothing at all. That's okay. So this is something we usually go over with patients at first to feel what's going on. I'll give you a little hint just so in case you ever do come to pelvic floor therapy, you pass the first pop quiz. The stomach is what we should feel move more than the chest. So that's your little sneak peek to pelvic floor therapy. But now let's see if you can find your pelvic floor muscles also. So I want you to think like you're stopping the flow of urine or you're holding back gas in a crowded elevator. When you feel those muscles contract, now, can you feel them relax? So, are you aware of the muscles doing any movement at all, or did you feel just kind of awkward doing it? Were you able to tell that you could contract the muscles, but maybe it was a small contraction. It didn't feel like it would hold back if you had to sneeze or cough. Possibly you got a great contraction and then you went to try to relax the muscles. Maybe it was delayed. Maybe it was a little hesitant. It didn't want to fully let go. If you fall under any of those categories, or again, you just couldn't find the muscles, you might be a good candidate for at least one pelvic floor physical therapy session to learn how to connect with the muscles to create issues from not happening in the future. So again, conditions that may benefit from therapy, anyone who just participated in that quick screen. Prenatal and postpartum recovery. So prenatal, we do offer birth prep as well as working on different laboring and delivery positions. Postpartum, once you're postpartum, you're always postpartum. So regardless if you're 6 months or 60 years and you've had a child, probably have some issues or may have some issues that are contributing from your postpartum period. Recovery after any gynecological surgery, bladder pain syndrome. If you have a history of endometriosis or painful menstruation, that causes a lot of muscle guarding, which can create a lot of pelvic pain. Postmenopausal pelvic changes, urinary issues, and then constipation or fecal incontinence. And I do always like to add the fecal incontinence one. I've had a lot of patients recently and they've mentioned they don't talk about it with their friends, their family, they barely mention it to their doctors. But if you do notice you're leaking a little bit of stool, even though it's more common than people realize, it shouldn't be your normal, and there's things we can do to help with that. So if you're interested in seeing what pelvic floor PT is all about, feel free to ask your PCP for a referral. Again, we're offered PT in Lake County, the Women's Health Clinic over in Cares Tower in Wade Park, as well as Canton and virtually. And I'm one of the therapists, and Jackie Mukaiman works out in Canton. And we're happy to meet all you guys and help you out any way we can.
So we have a question for you.
Yes.
So do you provide pelvic weights for those who would like them?
Great question. So we can order pelvic weights. I will tell people 90% of the time it's not the most optimal. It can usually create more pelvic floor dysfunction issues. However, if it's appropriate and the patient and you really feel like that's going to help you the most, absolutely can order those for you. If we think there's better devices I can work out for you, I will offer up those and give you my reasoning why. And if you're more agreeable to those, we'll order those for you instead.
Thank you, Marcia. Another question. Am I in the room alone or do I have someone there besides you?
Fantastic question. So the subjective is done just with me there. The objective assessment, specifically, of course, the pelvic floor assessment, we do offer everyone a chaperone. Patients have the option to accept or decline, but every single person is offered that chaperone there.
Thank you so much.
All right, and now I'm going to pass it to Dr. Susan Worthy.
Excuse me,
so
Doctor. Real quick, I just want to let all of our participants know that are joining us on WebEx that if they would like to ask a question, they can do so by pressing the 3 dots in the bottom right corner of their computer screen and selecting Q&A, and then they can type in their question and we'll be able to respond during the meeting.
So we have 2 more questions for you, Marcia. You're popular tonight. Are there apps that you recommend for building pelvic strength?
Great question. So app-wise, that you don't have to pay for, that's probably a little bit harder. However, if you want to YouTube videos, an excellent name that I usually recommend to people, and I follow some of her stuff too, she's a pelvic floor therapist and a Pilates instructor. And her name is Jessica Valent, Valent. Ton of free videos on YouTube, as well as she has paid membership, but she does a lot of perimenopause workouts, menopause workouts, pelvic floor strengthening workouts. Usually that's a very good place to start because it has a lot to do with core strengthening.
Her name is Jessica Valent, Valent.
Yes, and this, I have no connection to her at all. I just really like her. So
Check her out.
she's a lot of free YouTube videos. Usually I send some of that to my patients.
Thank you for the questions. Okay. Oh, here's another one. Oh, this one, they're just asking where they type. Yes, you type in the big box with the red words. Yes, that's how you put your questions in. Okay. All right, let's turn it over to Dr. Susan Worley.
Thank you so much, Dr. Aronovich. As a gynecologist, working with pelvic floor physical therapy is a really integral part to what we do every day. So now moving on to talk about next month. The upcoming month is July, and it is Menopause Awareness Month. I think it must be Menopause Awareness Month because we associate menopause with being hot.
Yeah.
July is the hottest month of the year. So the definition of menopause is when you've gone a full year without having a menstrual period. But the symptoms that we associate with menopause, like hot flashes, night sweats, irregular periods, vaginal dryness, and brain fog, can start long before you stop having periods. These symptoms often start during the time period of perimenopause, which means around menopause, and can last for several years before and after your last period. They can be very bothersome and negatively impact your quality of life. There are also lots of changes going on inside your body that you can't see or feel with your heart, bones, and metabolism. The good news is that we have excellent treatment options for people experiencing symptoms of perimenopause, whether that's long and heavy periods, or urgency when you have to pee, or disrupted sleep, or pain and dryness with sex. For many years, the medical community actually recommended against the use of hormone therapy based on some flawed scientific studies from more than 30 years ago. But we now have much more evidence demonstrating that hormone therapy is safe and effective for most people and may even protect against conditions like dementia. We also have options to treat these symptoms without using hormones. So please reach out to your healthcare team if you are experiencing any of these symptoms of perimenopause, or if you just want to talk about perimenopause. And so this is kind of little tips and tricks. If you are experiencing things like hot flashes, things you can do at home include dressing in layers, having a fan, eating a healthy diet, and exercising regularly. You can also avoid triggers like spicy food, hot beverages, overheating, and alcohol. But for almost anyone who is experiencing these symptoms, I would say it's at least worth bringing up to your healthcare provider and having a conversation about whether or not some sort of treatment might be helpful for you. And then just one more reminder that if you have any questions at any point, you can always call us at the Women Veterans Call Center, which is 855-VA-WOMEN. And we're also online at womenshealth.va.gov. And again, if you have any questions, please do put them in the Q&A at this time, and we are here to answer any questions for you.
Thank you, Dr. Worley. We have another question. Can I call and make an appointment to see a women's health provider, or do I need a referral from my provider? I have several women's health needs.
So yes, whatever CBOC you get your care in, there's always a women's health primary care provider there who's specially trained in women's health issues. So talk to your provider. If they are a women's health PCP, they can begin the assessment and then place a referral to Dr. Worley if it's a gynecology related thing. I wanted to put our phone number up in people's mind. It's 216-791-3800. And then to get our clinic here at the annex, the extension is 61055. And I encourage you to use that extension. Don't ask the operator to transfer you. Use that extension, 61055.
And I'll place that in the chat, Dr.
Great.
Leonard. There was a question about where we're located. So the Women's Health Center is located in Cleveland. We are located in the corner of East 105th and Magnolia. We are under the annex. So we are attached to the medical center, but we have a separate building. And our building is in and located within the outpatient garage. So it is nice because you can drive through the garage, stay on the first floor, and we're located within, follow the signs, and go right into our women's health clinic. We have dedicated spaces. We have wheelchair parking as well, and it's easy push button to open the doors as well as an elevator to get in. Okay. Let's see. How often do I need a physical exam, breast exam, and a pelvic exam?
Oh, boy.
That's a lot.
That's sort of a loaded
That is a loaded question. I'll let you take the first part.
Okay. So, a woman should have a physical every year is what we really recommend. If you have diabetes or high blood pressure, we usually see you more often than that. For those of us who are around my age, we were used to doing Pap tests every year. That has changed over the last several years. So oftentimes, if you have had normal Pap tests, it can be between 3 and 5 years. Mammography recommendations have changed a little bit depending on who you talk to, but it's yearly or every other year for mammograms. What do you want to add?
I generally tell people that the most important thing with either a breast exam or a pelvic exam is if you feel something is wrong or different, tell someone right away.
Yeah.
Because in many cases, it's not necessary to have, a women's health provider mashing on your breast every single year. There's not great evidence that that's what helps prevent breast cancer so much as having regular mammograms. And the same thing with the pelvic exam. We do occasional cervical cancer screening when it's necessary. For some people that is, every year, but for most people it tends to be every 3 to 5 years. But if you feel like something is wrong, that's always the right time to ask for an exam.
That's a good point because, a Pap test is a screening test. If you say, I just had my Pap test last year, I have a little bleeding and a little pelvic pain, I don't need to go to the doctor, that is absolutely not true. We need to see you for that. So, good question.
Another question. Are there support groups for women only at the VA? Let's talk to Nancy.
So, majority of the work I do as a chaplain sits in the spiritual realm, not the religious realm, which is group work. So, we respect all faith traditions and people of no faith traditions in that space, but we're going to be working on the spiritual spaces of our life. And in the women's only group, there's really a great core of women that are so supportive, so opening and welcoming to everyone joining into the space. And veteran to veteran conversation, there's nothing better than that. We talked on the way over that I can state something to a veteran that I know scientifically to be true, but when another veteran states it, it really means so much more. So all these groups are geared to women's issues, women's development and growth, their spiritual needs, their emotional and mental needs. I'm connected to MST, our military sexual trauma units, our IPV, intimate partner violence units, and moral injury. So all these groups are great support groups. We have focus and prompts and curriculum for each and every group. So they're not really an open format, but from these groups, a lot of veterans have formed their own social communities. Exchanged numbers, gotten together socially, done social support, whether it be in text, Facebook, Instagram. And I can't control that, but I do support it when it works well. I hope that answered your question.
And you offer in person and
I can do in-person individual sessions or by phone or virtual. All the groups are currently virtual. A lot of them focus on emotionality, embodiment, the concept of how do we come to befriend this body, love this body, inhabit this body. So many of our veterans have a tendency to disassociate, outsource their emotions or events in life. So what would it mean to bring those back in? And how do we do that? And from my perspective, we do it through the creative arts. That means no experience necessary. We're not looking to make you a great artist or writer. What it is about self-exploration. What shows up on the page, what speaks to you. And that helps relax your parasympathetic nervous system, and it allows you to have better problem-solving skills. Works with meta-awareness, neuroplasticity, all that stuff that as we age, we really want to keep cognitively in good shape.
so how would they get started on these support groups?
So you can put something in the chat. We'll put my telephone number. I'm at the Wade Park number that ends in the 3800, and my extension is 68530. Again, you can mention it to any of your mental health providers, your primary care physician, and they'll tag me in the note. I'm Chaplain Nancy Lucian. They'll tag me in the note and I'll reach out to you. I'll get you on the cohort and get you enrolled in the group. Links go out every week for them. We're offering 8 groups currently, at least half of which are women's only, some that are co-ed, but we're on a virtual platform, and most of our male population, unfortunately, is not signing up for the touchy-feely stuff. Go figure. So they're not really signing up for a lot of the art or the writing. But when they do come into this space, they're already screened, they're appropriate, boundaries are set, and it's virtual. So it's a good way to experience new boundaries, appropriate boundaries with the male population if that's been a struggle for you.
Thank you.
Can you talk a little bit about the mural?
So yeah, we have, this actually made the news, I think it was 2 or 3 years ago.
You were on the news.
Channel 5 did us on the 6 o'clock news. I do a mural, a collaborative art mural with our veterans once every 2 years, and it's a female-only group. And an image is decided. None of the veterans know what the full image is. I do. It's printed out on sheets of 8x11 paper, and it's put through a computer system called raster.com. And Raster takes an image that may just be an 8.5 by 11, and I tell it how big I want it. And in this case, we want it 3 foot by 6 foot. And it expands the image without distorting it, and then prints me a PDF. So I have all these, I think it was 45 sheets of paper, and 9 veterans are chosen, and the images go out to them randomly in groups of 5, and we meet for 6 weeks, and we talk about the concept of flow. What does it mean to be mindfully in the flow, that place where you're so lost in what you're doing that time and space fall away, and it feels like just moments have gone and it's really hours. We talk about expression. What does it mean to be self-expressive? What does authenticity mean? What does mindfulness and meditation mean? Each session is done on that. And at the end, all the sheets of paper are sent back to me, because during those sessions, you're doing artwork on them. You're not allowed to show each other's artwork. We send them back. We digitally photograph them to get the rich color and the texture that you've used. I send the images back to you, and then we recompile the image. We've had, the first year was a wave of water moving back on itself, and it was called Rising Water. And the one that's up right now is a lotus flower. And the story of the lotus is no mud, no muck, no water, no lotus. So everything has a spiritual connotation. So from the mud and the muck, this beautiful flower emerges and reaches for the sun and blooms and floats on the water. And so, and this past year's of the lotus flower, the veterans also got to write all on the outside pages of it in their own handwriting. Empowerment words, poetry of their own or others, songs, all different kinds of things. One person put from Finding Nemo, just keep swimming. Informations they had written in that. And then the centerpieces are all the images, and none of the pieces butt up against one another. So it's amazing to look and see that I had 5 pieces that were random across the page, and say Marcia had 5 pieces that were random across the page. And when we put it together, everything meshes together and creates this beautiful image. Such diversity, but unity in the space. And so as soon as you come down the first 3 stairs to enter into women's health, it is right in front of you, 3 foot by 6 foot, and we do it once every 2 years. And what's nice about chaplaincy in women's health right now is I am aligned with Whole Health. So I provide Reiki, tapping, aromatherapy, all of that. I'm sorry if we lost our PowerPoint on you. We're going to try and reboot that up. We're going to try and stop sharing and then reshare. So just give us a minute on the PowerPoint.
So here's another question that we have. We have a gal that's asking if we have 3D technology for women with dense breasts, and can she have her mammogram through the VA?
Would you like to try that? Yes, we do have 3D mammography. We have for several years. So the answer is yes. As far as dense breasts, you know, the state of Ohio has required that all radiologists have to report breast density on the mammography. We don't have really any recommendations for what to do about dense breasts. We know there is some increased risk of breast cancer in dense breasts. Why we would encourage you to see our high-risk breast clinic to get a risk evaluation. In women that have an elevated lifetime risk, which is a 20% or greater lifetime risk, we do add breast MRI to your regimen, where you get a mammogram every year, you get an MRI every year, about 6 months apart. So please ask for a consult or give us a call to that number. Again, 216-791-3800, and then 61055 is our extension.
So the next question is an interesting question, because, you know, sometimes we see our providers maybe outside of the VA, your provider may not just have that amount of time for you. So again, this is a concern for one of our veterans. She's asking, how much time do women's health providers spend with their patients?
Okay. So our appointments are 30 minutes long for a standard appointment, 60 minutes for a new patient, and 60 minutes for any annual visit that includes cap and pelvic exam. And we can always request for, you know, that 60-minute visit if we need to. I don't think that's anywhere else. You know, it's like 15 minutes in the civilian world.
Well, and it brings up another point, Dr. Leonard, is in the VA and throughout the clinics, let's say you come in and you see your provider and you're going through maybe some mental health crisis, we can do a warm handoff. And that is very special for the VA that we don't see.
Yeah.
On the outside
Oh my
world, we don't
goodness.
see that. And it's something very special to the VA, very special for women veterans as well. We do have dedicated staff, social work, we have dedicated chaplain, obviously, and we have dedicated mental health workers. And they're just a quick phone call away that we can get that assistance for you as well.
Yes.
And that way you get to also stay with that care provider who maybe even noted it so that they can walk you through that process of what a
Right.
warm handoff is.
Instead of just walking out with maybe a phone number or somebody else to call, we're taking care of that issue right now.
Yeah.
That is very important. So Mary says she is tap dancing because the chaplain service programs sound like fun. Can you share the extension again? I'll play the extension again.
Mary, I can't wait to hear from you.
That's adorable.
They're great fun. We play too little in life. When we grow up, we're told that those things are for children and they're not. So the programs I offer are very unique to our Cleveland VA. We have this whole umbrella of the creative arts. I also do drumming. I haven't done drumming in a while, but I also do drumming groups, and I do drumming on a national level with our national VA. So there's lots of fun things to be had, a great sense of community, while we're also doing great therapeutic work on building resilience, emotional tolerance, and getting to know ourselves, reflecting and getting to know ourselves much more deeply.
Here's another question. Do you have a place to go if I am a woman veteran and I'm suffering with homelessness? Do you have a place for me to go?
On Izzy.
So, and joining us is Isabel, and she is our social worker, and we're just squeezing her in.
Hi, everyone. I'm Izzy. I'm our women's health social worker here at the Wade Park Clinic. So the answer to that is yes. And there's a lot of different things that we can do depending on, the situation and where things stand for you in that moment. My recommendation would be every primary care provider and specifically every women's health provider has a social worker in their clinic. So if there's ever any psychosocial concerns, whether that's homelessness or it could be anything related to financials, transportation, education, work, just kind of the catch-all. If there's a problem that you feel like you're having and struggling with, I encourage you to bring that up to your primary care physician. They will immediately get you connected either in a warm handoff or they can place a consult so that we can have a more scheduled appointment as well. But the social workers are here to kind of plug everyone into where they need to be. So, homelessness is one aspect and one situation that we see veterans, struggle with. So absolutely social work can help, get you the appropriate resources to address that.
Thank you.
You talk about food insecurity too.
Yeah.
That's, I know, a need to.
Yeah, so again, it's kind of a broad umbrella. I kind of threw some topics out there, but it really, again, that's kind of why I encourage if there's any psychosocial concern to kind of bring it up, because social work can typically at least get you to where you need to be or give you a contact, plug you in. But one of the things that we are seeing a lot in our clinic here, but also more broadly, just across the country and in other clinics is food insecurity. So people who are struggling to either pay for food, have access to food, and things of that nature. So we are working in the very beginning processes here. There's a few, again, social workers can get you plugged into a lot of community resources and things of that nature, but specifically, something that I am personally working on with some of our other social workers here on site is trying to create what would be a food hub here at Wade Park, but then also the goal would be to expand that to other CBOCs. So we're in our very, very beginning stages of it right now. We're hoping to pilot a mobile food pantry at the Parma CBOC in the coming months. I'm sure you will be hearing a lot about that once we officially get the go-ahead and the okay. But we are working on getting that plugged in and hopefully creating a more robust hub that would not just give access to food, but provide dietary input to that food, how you can cook that, cooking classes, if there's other benefits needed like SNAP or other community resources that we can plug you into, that it would kind of be a one-stop shop to address all of those food insecurity needs that we're seeing.
Thank you.
Yeah.
Thank you.
Thank you, guys.
Something if I could mention, so all the faces you see here and so many more that are behind the scenes, we work very closely together. So we do a lot of warm handoffs with one another, as well as when we see something that comes up in the room with a veteran, we'll say, can I connect you with this person? Or this might be beneficial. Can I give them and share your information? So we do a lot of that work back and forth. I think of the work I do with Kate Quinn, our maternity care coordinator, for a lot of our veterans that have to come off some medications while they're pregnant and are struggling to cope. And we're upping their mental health providers' time with them, but then we can also add things like Reiki, tapping. So we do work really closely with one another in that. So you're very lucky in that. And the second thing is that VA providers have this, I don't know if I want to call it an inside track or what I want to call it, but we understand a military construct. So we have an understanding of what's already laid groundwork in you and kind of baked into your DNA about being a part of the military. And so we come with some trauma-informed care that you might not find elsewhere, and some understanding of what we may be hearing or not hearing in a conversation that has to nod towards the military. Whereas outside sources outside the VA may not have that capability. We do a lot of training in that. So there's a lot to be said for sticking with a VA provider. They might understand you better.
Thank you, Chaplain, as always. Here's a question. What is the link or contact info to sign up for the Women's Health Services? Do we have transition care on? Jennifer, are you on our call?
Hi, yes, I'm on the call.
So how would someone get started if they're maybe a new veteran that's not signed up for care yet, or they're new to our facility? How would they get started?
Yeah, so hi. So I am Jennifer Schmidt. I'm a registered nurse case manager, and I work with sorry, let me put my camera on. I work with the post 9/11 military to VA transition case management program. So basically, our main job is to help transition new veterans into the VA system. So we work very closely with the military because we do get a lot of referrals from the military, from servicemen and women that are either retiring from the military, medically retiring, separating for a certain number of different reasons. And we'll get those referrals. And what we do is we're kind of like that liaison between the military and the VA. So a lot of times we are, I like to say sometimes we're like the face of the VA, because sometimes we're the first people that they do have contact with before they go to their first VA appointment. So how that process would work, and it doesn't necessarily even have to be if someone's just newly leaving the military. This could be someone that's been out of the military for a number of years and have no clue that they are eligible for VA healthcare. So what you would want to do is you would want to go to the nearest VA center. Wade Park is the main, VA hospital. But as was mentioned earlier in the call, there are a bunch of different outpatient clinics that may be closer to you where you live. And what you would want to do is you would want to go to your nearest VA clinic. You would want to fill out what's called a 1010. And that basically is the form that the VA is going to use to help determine if you are eligible for VA health care. In addition to that form, though, you have to provide your most recent DD-214. That DD-214 is key in helping the VA and administration eligibility staff figure out if you are eligible for VA healthcare. Once the VA has those two, they determine your eligibility. If you are eligible, they will go ahead and enroll you, get your chart going, get you registered, and actually then that way you can get your women's health appointment scheduled. It's a little different when we work with men and women that are coming out of the military, because what our department does is our case managers will call, let's say, primary care or women's health and speak to scheduling and get that first appointment scheduled for you. So like I said, we are that VA liaison. But if you're not coming out of the military and you're not engaged with our program, and you're just kind of coming in from, let's say, you know, off the street, you're new to the VA and you get that 1010 filled out, the DD-214, staff there can also help get you scheduled for a women's health appointment. So that's pretty much how, so how you would get signed up for, to get your first women's health appointment. And if you have any other questions, I'm available to answer this evening.
Thank you, Jennifer, for all your help.
You're welcome.
Appreciate it. Are there resources available if I'm trying to conceive? Yes. First, anyone that's suffering with infertility or has infertility concerns, start with your primary care provider. Some things we can handle internally with gynecology, such as Dr. Worley could see you through the VA. And sometimes they may send you to community care, and we would refer you to community care through your provider. Everyone is eligible for a fertility consult, but if we can do something internally with our gynecology services, we'd like to start there first. Anything you'd like to add about that, conceiving?
We have a lot of options, prior to needing the services of specific infertility doctors. We can check your hormones, we can look at different medicines to help with ovulation. We can look at tracking your ovulation to help you get pregnant. So there's a lot we can do right off the bat.
That's a great question. Here's another question. Are all doctors or providers trained to do my women's health annual exam?
All of the women's health designated providers are, yes. And with every clinic, there is a women's health PCP available. So if your particular provider is not a women's health PCP, there is someone in the clinic that they can refer you to that answers it for you.
Excellent question. So there's another shout out for our chaplain. Jasmine gives thanks to the chaplain. And she also said that her provider asks those needed questions, like we were talking about mental health, up front in a very gentle way. And I think you will find that with our VA providers. As Dr. Leonard mentioned, we have our women's health providers at every facility, and they are trained specifically for the needs of a women's veteran. So they go through what's called a mini residency. They spend time with providers such as Dr. Leonard, Dr. Worley, and just are able to address those needs in a little bit more of a gentler way and taking that time needed. Sometimes women come for sometimes they don't want to come to their visits because they're afraid, well, I'm going to have my pelvic exam, so I'm just going to cancel my appointment. Come anyway. Come to your appointment, make the decision at that time. But at least come, spend some time with your provider. They're not going to make you do anything you don't want to do. And I think it's very important for you to know, but at least to go through medications. What can we help you with to get you to the point that you'll have your exams maybe at a later date? But let's get you in the door. Let's get you seen first. And then from there, we'll address those fears and those concerns that you have.
I've been called in too for when there's a pelvic exam as well. I've been called in advance, brought in aromatherapy for the veteran.
Great idea.
Did a safe place guided imagery with them. I offer to stay at the head of the table if they'd like me to, or if not. And then afterwards we debrief on what it was like, how are they feeling, making sure they're safe to go home. So that's always an option too.
Keep your appointments. Don't be too afraid to come see us. Don't no-show. Just come to these appointments. These are lovely people to come and see. And we want to see you. We want to care for you and meet you where you are. So we only have like 5 minutes left. So if you do have a question, please submit it now. And phone numbers for our Reverend Dr. Nancy Lucian, 216-791-3800, and then extension 68530. Oh, here comes a question. Do we need a referral for mammograms, or can we self-schedule? What is the wait time for this?
Yeah, you can't self-schedule. You will need an order from your provider. Typically, the wait time is sometimes a few days to a few weeks. There's also a mobile unit in Canton that has usually a lot of openings. So if you're in that area, it's available. But yes, need an order and it needs an appointment.
And when the providers put them in, then they come to me and I run through them real quick and we get them scheduled. So there's 2 forms. You can have it if you're within a distance. If you're within 60 minutes, we want you to come to Lou Stokes in the main medical center for your mammogram, for a screening mammogram. Or we want you to, like Dr. Leonard said, the screening mammography is in Canton, right outside the outpatient clinic. And they've got a couple days a week that they offer that. If you're outside that, or if you have specific needs that you can't climb stairs and you live close to Canton, we're going to send you out to community care. Community care, we sign those off, and community care starts calling you the next day. So our biggest slowdown sometimes is just connecting with community care. So if community care calls you, call them back because they're trying to help schedule you for those appointments. Okay? And Karen just says, thank you so very much. I'm excited to use this important benefit to better care for myself. And we appreciate it. That's what we're here for. And one thing that Nancy did say is, we work as a team, but we work as a team at the medical center, but we work as a team within the outpatient clinics too, where you're not isolated. If you're in Mansfield or if you're in Sandusky, we are still part of that team. The technology is great. We can get you on Teams and we can still coordinate your care for you and be a great assistance. One question was, is the recording to be online or available? We will have that. I'm not sure how long it'll take to get it recorded, that we can have that available. Probably within the next,
Maybe by tomorrow.
probably tomorrow or the next day. You can check it out and you'll be able to view this. So let's see if there's any more questions that we have. Another question. Oh, do I need to go to my doctor if I know I'm pregnant and I need a maternity care consult?
You don't need to come into the clinic, just give us a call. We want to talk to you and have some preliminary questions and get you connected to a maternity care consult.
It's amazing what's offered through maternity care. Although we don't birth babies in the VA, and we will send you out to the community.
I could deliver a baby if you help.
She would, and she probably would. Lots of services, lots of support, even a breast pump, pads, all those items, as well as childbirth classes are free. Here at the VA, we have a lovely gal, Catherine Quinn, who does those for us. So yes, so you definitely want to seek out our services for sure.
Yes, veterans belong here. You're a veteran, you belong here.
And Kate Quinn and I are working on trauma-informed birth plans for our veterans.
What does that mean?
So a trauma-informed birth plan is how do you feel about who should be in the room, how often they should be in the room. Is it okay to have a revolving group of nurses? Is it okay if it's a teaching hospital to have them in the space? What are your go-to skills? What do they need to know about you that they're not going to find in your chart? Just a plan because you may be a survivor of military sexual trauma or intimate partner violence. And that's not something a lot of people talk about, but it can inform the way your birth plan is laid out.
Last question, is there a minimum length of time to try to conceive before being eligible for fertility treatment? This is a big question.
So I can take that. In terms of how long you've been trying and you want to talk to us about fertility, come anytime. In terms of the amount of time before we refer you to like an actual infertility in the community provider, it's usually the time cutoffs we use is 6 months of trying after age 35 and a year of trying before age 35. So if you are 35 or older and you've been trying for 6 months, let us know and we can get you referred to the infertility clinic right away. And if you are younger than 35 and you've been trying for a year, same thing. But if you at any point want to talk about fertility, if you've been trying for 2 months and you're frustrated and you want to just hear about options and tips and tricks, we can have that conversation at any time.
Thank you all for joining us today. Thank you, panelists. This was a great town hall, and we thank you for joining us, and have a great evening.
Thanks. Bye.
Bye, everybody. Bye-bye.